Good morning, or actually good afternoon, everyone. Thank you for joining us. It looks like we still have people logging on, but we'll start the presentation now because we want to respect your time. We are recording this, so we want to make sure that you know that you will be able to have a recording, and then we'll be able to send it out to the business community afterward. But my name is Janet Kenefsky, and I'm the Vice President of the Greater Vancouver Chamber of Commerce, and we welcome everybody to the Mind What Matters. We're talking today about business community immunity, which is a topic that's on the forefront of everybody's minds, especially as we're re-entering the workplace. We're looking at bringing people and our employees back into offices. How do we do that? We have a lot of questions, and the Chamber of Commerce has been working with a lot of different organizations, including our medical facilities, on getting the information out to our business community on how we can open safely, and how we can handle those questions that might come from our employees, our staff, and even from some of our consumers who might be looking at re-entering our place of work as a patron. So today, we're going to be joined by a very esteemed panel of organizations that spend a lot of time working with the Chamber of Commerce and our business community to make sure that we have access to information, people, and a place that we can ask our questions to. So we're really excited to have this Mind What Matters for you today. We are a couple things I wanted to go over before we do. I want to make sure that everybody identifies while we're in presentation mode. You have a box off to your left or off to your right that's called General Chat. If you guys can find that and let us know who you're with, we'll be able to see your name. Let us know what company you're with. Let us know that you're here. And I want to make sure everybody knows where to find that general chat. Perfect. Bonnie, nice to see you. So once we use that chat, I want you to identify the general. You can also do a participant search on there as well. Great. Good. We've got quite a few people here. Nice to see you, Renee, Brad, Jim. Thanks for joining us. Aaron. Thank you as well. So we're going to use that chat. We want to make sure that you use this for any question and answers that come up, because at the end we are going to do a panel and be able to have an opportunity to ask a whole host of questions that we've come to this meeting with or webinar with, but I'm sure you're going to have a lot of questions throughout the presentation with a lot of good information that's going to be thrown our way. So as you see questions that it pertains to you, your business, your employees, access, or if there's questions that you have on the reopening, please make sure to answer them here. If for some reason we run out of time, we'll go ahead and cultivate those questions and then make sure to get out some of those answers to you in email form. But after this is done, we are going to be able to send to everybody the link of the webinar so you can watch it, you can send it to your staffs, etc. So we are going to get started, but before I do, we have a website, your chamber, or email, yourchamber@vancouverusa.com. So we'll put that in there. We do, for the business community, have available through the CREDC and Chamber of Commerce non-contact forehead thermometers for free for our business community members. We want to make sure that you have the tools in order to keep your patrons and your employees safe. And we have access to quite a few that are available. So if you want to email, Hadley, thank you for putting that up, your chamber at Vancouver, USA, we'll make sure to get one of the thermometers dropped off to you. This is a very important tool as we look at keeping our community safe as we continue to open our doors to employees and public. So to get this started, if you have questions, again, use your chat on the right-hand side. But I would like to introduce Dr. Neville. Dr. Neville is going to be joining us as the moderator for today's panel. And while he has an extensive bio, and I'll shorten it down for you because we want to get to the meat of the presentation. After Dr. Lawrence Neville completed his fellowship in neuromuscular EMG at OHSU, he served as vice president and medical director for PeaceHealth Medical Group, the Columbia Network. And then he currently serves as the chief medical officer for Southwest Medical Center. And we would like to welcome Dr. Neville to the stage, who will be moderating, giving some great information for you all today. Hi, Dr. Neville. Thank you for joining us.
Yes. Well, I'm just delighted to be here.
Yeah, we're really excited, and we do have a lot of questions that have come in from the public, from our business community, and I think this is going to be one of those topics that is widely anticipated and going to be viewed over and over again in the coming week. So I thank you very much for being here and being able to share this important information as our business community continues to open up.
So again, just delighted to be here, Janet, and everybody in the virtual room. It's a real honor to have time with you today. As Janet mentioned, I'll be serving as a moderator for our time today, which is, a real pleasure for me, because I know most of my fellow speakers and have great esteem for them, and look forward to introducing them to you momentarily. So just as we get started, just want to acknowledge two things about this topic. One is an immense excitement that I think we all share to reopen business, to continue to expand the businesses that we engage in. And the fact that we're at an inflection point where a lot of us have had, very strong emotions over the last year with the pandemic. I've got seared in my memory the sort of look of defeat on the part of some of my ICU docs midway through the pandemic, when they were they'd seen about 400 of the 800 patients that Southwest has had the privilege of taking care of with COVID during the pandemic. They were exhausted, and they were asking me, how can we get through this? How can we do it? And they did get through it. And then flash forward to more recent, a month or two, where I saw very hard-bitten surgeons that I thought would never even smile break down in tears as they got their vaccine. And that whole panoply and whole span of emotions, just really tremendous. So excited to share some of the science with you about how to navigate the coming months as best we know. And one thing I'll just say is, feel free to ask us questions that you may think are just sort of clarification. What did you mean by that? What does that word mean? If we use a word that's technical, we don't mean to do it, but sometimes we lapse into jargon, and please feel free to call us out with that. So without further ado, I want to turn it over to a dear colleague of mine, Dr. Alan Melnick, who many of you know is our Clark County Public Health Officer. And he's going to talk to us for about 9 minutes on some of the epidemiology of COVID in our community, and a little bit about what's happening at a very high level in the community that's going to build into some of our later discussions about vaccines and other topics. So Dr. Melnick, over to you, sir.
Thank you, Dr. Neville. So there is light at the end of the tunnel, and I like to hear that people are looking forward to that. I'm sorry to bring up some caveats to that as well. So one of the concerns, so I'm going to talk about the concerns, and then I'm going to talk about the vaccine a bit, and the good news about people who are fully vaccinated on what they can do. But the bottom line is our case numbers. We've had 3 waves, and the last wave and past the holidays into January was the most severe wave that we've had. And after in January, our case rate, we look at the number of cases over 14 days per 100,000 population. We had gone to about 474 cases per 100,000 population over 14 days in Clark County. And that at times, and if you remember back to January, we were seeing over 200 cases a day. So the good news is that we actually came down from that peak. And a few weeks ago in mid-March, we had actually gotten down to about 89 cases per 100,000. So, and we plateaued there for a while. I just want to compare that to where we were last summer when we were applying for to get into a reopening phase. We were below 20 per 100,000. Now we're feeling good because we got down below 100. But since then, since mid-March, the case numbers have been going up, and we were at seeing about 30 cases a day. We're now up to 50, and yesterday we had 76 cases reported. Our rate per 100,000 has gone back up to 139.8. And fortunately, you may have heard the news that on yesterday we were allowed to remain in phase 3 because our rate is below 200 per 100,000, and our hospital admissions are below 5 per 100,000 over a 7-day period. That being said, there were 3 counties that have gone back to phase 2 in the state. One of them is Cowlitz. Their rate is well over 300 per 100,000 over 14 days. The other 2 are Pierce and Whitman. Every other county in the state stayed in phase 3 of opening, which will continue until it will be reevaluated again May 3rd. So we're in phase 3 with the good news for the next 3 weeks. The bad news is that our case rates are increasing. And one might ask, why are those case numbers going up? Which gets to my next topic. One is, unfortunately, we know this from the studies we've done before, that a number of people, especially young adult and middle-aged adult populations, continue to engage in behaviors that are associated with disease transmission. So that includes, not physically distancing and not masking. And those are where we're seeing the greatest numbers of increase. Actually, throughout the pandemic, that's where we saw the greatest number of cases. The deaths are more concentrated in older adults, elderly adults. The other issue that's happened is, and this is another reason for being vigilant, is the emergence of variants, genetic variants of the SARS-CoV-2 virus that, and the variants, I'm going to talk about the variants of concern. The variants of concern that we're seeing, by definition, variants of concern are viruses, virus variants that are more transmissible, as well as potentially more contagious, more lethal, and maybe, and some of them may be less protected. The vaccine may be less. The vaccines available may be less protective. Right now, in the state of Washington, 90% of the cases are associated with variants, and one of the ones that is a main concern is a UK variant, the B117 variant. Started in the UK, took over there. Earlier in the month, here it was already in Washington State. It was already responsible for 35% of the cases in the state, and it's projected by mid-April, which is where we are, is to be 50% of all cases will be related to this particular genetic variant of the virus. This variant is a lot more transmissible significantly more transmissible than garden variety SARS-CoV-2 virus. And a recent study in the UK of a low-risk population indicated that it was 60% more lethal, although there's been a couple of studies even more recently since then that indicated that it's not more lethal, but I think we're still watching it really closely. You might have also heard about the California variants. They were at 50% responsible, but their doubling time is they take longer to multiply than the UK 117 variant, and that's likely to crowd them out. And the B117 variant is likely to take over. Again, more transmissible, possibly more complications, including death, although the jury is now out on that. And fortunately, the good news about the 117 variant is that it's the 3 vaccines that are available protect against it. But this is even more reason why we need to be vigilant, because the more virus that's out there in the community, not just in Clark County or in Washington, and by the way, the rates in Washington are going up as well. I'll get to that in a second, but the rates are going up nationally and even globally. And the more virus that's out there, the more opportunity it is for it to mutate and create new variants that may be, concerning about responsiveness to the vaccine, protection from the vaccine, transmission, or associated with complications. I should mention that one of the ways we look at the rate of increase in the state is around something called the reproductive number, the number of cases that each each person transmits to, the number of new cases that result from being exposed to one case. And right now, you want it to be below 1, that each case produces less than one other case. But right now we're at 1.38. So each case causes 1.38 other cases. And you do the math, 1.38 times 1.38 and so on. And you can see you get exponential growth. So we're getting a significant amount of increase in the state in terms of COVID-19 activity. I can talk about how we identify variants. I don't think I'll have enough time with 9 minutes, so I'll leave that out for now. But I can explain how we detect that. The good news is vaccines are increasing. The first 11 weeks of vaccine rollout, you might recall, you might have heard in the news that Clark County and Southwest Washington actually received less vaccine compared to other parts of the state. But our legislative delegations, our elected officials, Congresswoman Herrera Butler all advocated for more equitable distribution to Southwest Washington and Clark County. And the amount of vaccine we got per week from the state went up from about 4,200 to about 14,000 first doses per week. Consequently, we've got more than a quarter of the population, 28.8% of Clark County residents have now received their first dose, and close to 19%, close to 1 out of 5 are fully vaccinated. 65% of those 65 years and older have received at least 1 dose, and 52% of people over 65 are fully vaccinated. We're still less in the state, but we're closing in on them. The bad news is that of the people who received 1 dose, 73% are white, and 74% who are fully vaccinated are white, and only 5% of Clark County residents with 1 dose are Latinx, even though they make up, at least more than double that in terms of the population. So we need to do a better job of getting vaccine out to BIPOC communities, BIPOC populations, both in Clark County as well as the state. Beginning on April 15th, which is coming up, this Thursday, everybody 16 and older will be eligible to be vaccinated, and we're encouraging people to get vaccinated as soon as they're eligible. And we're hopeful with more of the vaccine coming into the community. And we can talk later. I'm not going to go into it now about the issue with the J&J vaccine. I'm sure that will come up with questions. But as more vaccine becomes available and more people get vaccinated, we can can help reduce transmission in the community as well. People have heard the term herd immunity, enough people to be protected that you can basically prevent any transmission. Herd immunity for COVID-19 may be somewhat elusive. First of all, we need to get a substantial proportion of the population vaccinated, and probably 70 to 80% of that. But then we also don't know for sure how long the vaccine is protective for. We're still learning. So there may be requirements for boosters as well. And certainly ongoing, we're gonna need to address resistance, people's hesitancy about getting the vaccine, which we're already beginning to see. So herd immunity may be elusive, but the more people get vaccinated, the more we can reduce transmission in the community. There are benefits in terms of getting back to what people think is normal. There are benefits to getting vaccinated besides preventing severe illness and death. You're fully vaccinated 14 days after your second dose of the 2-dose series, the Moderna or the Pfizer, and 14 days after getting the Johnson & Johnson vaccine. Those who are fully vaccinated can gather indoors with other fully vaccinated people without wearing a mask. And you can also gather indoors with unvaccinated people from one other household without masks, as long as nobody's at increased risk for severe illness. So if grandma and grandpa are vaccinated, they can get together with their children and grandchildren from one household who may not be vaccinated. But as long as grandma and grandpa, they can get together with that family without masking. Also, somebody who's been fully vaccinated and has been around somebody who's been in close contact with somebody with COVID-19 does not need to get quarantined or tested unless they develop symptoms. And the exception to quarantine is for those who live in congregate group settings like jails or shelters, as well as inpatients of hospitals and residents of long-term care facilities. Certainly in public, whether you're vaccinated or not, we know the vaccines are not 100% effective. People are in public. We still need to practice physical distancing, masking, and certainly when gathering with unvaccinated people from more than one other household. And when visiting with somebody who's at increased risk of severe illness from COVID-19. And we're still urging people to avoid the medium and large gatherings and to follow the guidance within their workplace. I don't know how close I am to the 9 minutes. I suspect I am. If I'm not, I'm happy to talk more about variants. Otherwise, I'll just kind of leave it at that.
So, Dr. Melnick, that's actually a perfect ending point, and I'm sure we will return to the variants during this discussion. So thank you very much.
Thank you.
So Dr. Melnick has brought us, I think, some really exciting news about the vaccines and some of what it allows us to do, and some sobering information about some upward trends and reasons to be concerned. So it's a great time to turn this over to Ryan Irwin, who's our Director of Pharmacy and Clinical Support Services for Legacy Salmon Creek, to talk a little bit more about the good news related to the vaccine. So Ryan, over to you.
Thank you very much, Dr. Neville. Yeah, I just wanted to talk a little bit about the vaccines. Dr. Melnick did a great job as always, and I'm sure we'll talk a little bit more about it. I jokingly said earlier today that I'm glad I'm a procrastinator, because if I had done all of this yesterday, I would have had to redo a lot of it with the Johnson & Johnson news this morning. So just going to talk really briefly kind of about the three main vaccines that we have available right now in the U.S. So we've got two vaccines that utilize mRNA. So those are the Pfizer and Moderna vaccines that the vast majority of people who've been able to get. And then we also have Johnson & Johnson, which is an adenovirus vaccine that just got approved, and then just came out today that the AdCom, who advises the FDA about vaccines, asked for a little bit of a pause due to some side effects of the Johnson & Johnson vaccine. Particularly, they've had 6 cases in the U.S. of cerebral venous thrombosis associated with people who'd gotten the vaccine about 6 to 13 days after that. I do want to put those, not to minimize, but just to put into perspective, those 6 cases are out of about 7 million doses that have been administered. And it's been very specific in women 18 to 48 years old. So I think they're going to be looking to give some clarification in the next couple of days about what we should be doing with the Johnson & Johnson vaccine moving forward. Right now, really kind of the main differences between the vaccines, and to quote Dr. Melnick, as he said, I think in general, the message that we're giving to folks is that the right vaccine for you is the one that's available. So I don't believe many places are allowing people to choose which vaccine they get between, say, Moderna and Pfizer. I think for the community, it varies a little bit about what vaccines are available at which site. I will be putting some links, if it's okay, in the chat for people to go ahead and check out. Number one being the vaccine locator page that allows people to see who has available appointments to schedule online. Great website. Oftentimes it's updated by the vaccination sites regularly, and there's an option there to see what vaccines that they are administering. So with the Pfizer vaccine and the Moderna, they're both a 2-shot vaccine. They're a little bit different in that the Pfizer has about a 21-day window between the shots, and the Moderna has about 28. Those are much more apples to apples vaccine. They have very similar in terms of effectiveness. The side effect profile is pretty similar. Pfizer has a little bit less side effects, but again, you should be taking whichever one you have available. The Pfizer is also different in that it's eligible for people down to 16 years old, whereas Moderna and Johnson & Johnson are both 18 and above. So Pfizer has also recently asked the FDA, I think on the 9th of April, they asked the FDA to extend the emergency use authorization to 12 to 17-year-olds as well. Studies are ongoing in kids younger than that, but I wouldn't expect us to see anything available for 11 and under until the fall time likely, unless anything really changes with that. So again, just to kind of go back to the Johnson & Johnson, because that's on the forefront of everybody's mind, that is a one-shot vaccine, and it is really appealing for some folks because of that one shot. In terms of folks who it's hard to access, it's really been a great tool, and I think many of us are really looking forward to continuing to use that. There's also an Astrazeneca vaccine that also uses an adenovirus as well, and they have seen similar side effects regarding the cerebral venous thrombosis associated with that vaccine as well. I think the working hypothesis right now is that the adenovirus elicits an immune response that causes the platelets to aggregate and can cause those clots. So they're really thinking it might be kind of a vaccine class effect right now, but again, we're talking less than 1 in a million right now that we've been able to see. So the pause is really associated with making sure healthcare facilities and providers know what to look for in people who have been recently vaccinated if they come and have a really bad headache, have swelling in their legs, things like that. So again, looking forward to further guidance from the FDA and CDC, and to be able to see where that goes from there. Dr. Melnick also hit a little bit on boosters and the need for boosters. I think right now, definitely the messaging is that it's too early to tell. As he explained, there are more and more variants out there. The nice thing with the mRNA vaccine, it's a little bit easier in a manufacturing process to be able to change what's in there and kind of plug in there what's a new variant and how to protect against that. I guess if I had to say yes, we're going to have boosters, or no, we're not, I'd probably err on the side a little bit that there might be the possibility there's boosters in the future, much like the flu vaccine that changes every year. There may be a little bit of a need for boosters to have variants. Again, that's just a best guess, not any kind of hard proof for that. Again, as the line really is that we're kind of having a wait and see approach regarding to boosters. I would say I feel a lot more comfortable about the ability to execute that as opposed to say 6 months ago when we hadn't ever done this before. So also just in terms of looking to where to get vaccinated, I'll put in the chat the vaccine locator. All of us represented on this call are on that site. It's really, really handy. I'm also going to put in a few more in-depth things because I can't possibly go into all the detail, but I'm going to put in there, New York Times has an awesome COVID vaccine tracker that tracks all the vaccines around the world that are currently in process and where they're at. The other good news, it's hard to compare efficacy from the studies as they were each done at a little bit different time when vaccine prevalence was different and the variants were different. So it's a little bit of apples to oranges. I'll put a link in also for the CDC had a great real world study from I think December to March where the Pfizer and Moderna vaccine were still 90% effective. Which is really unheard of. I think just initially folks heard the little bit lower efficacy rate of Johnson & Johnson of about 72% as opposed to the 95 and 94% of the Pfizer Moderna. That is still really, really good for vaccines. And again, the best vaccine is the one that's going to be offered to you. And so with that, I'm going to kind of put the rest in the chat there, but thank you guys very much for the opportunity, and I'll pass it back to Dr. Neville.
Thank you, Ryan. That was awesome. Thank you so much. So we will be coming back with some questions for Ryan. Thank you for those of you putting questions in. Please continue to do so in the chat box. We are collating those so that we can ask those at the right time. So it's my privilege to talk just a little bit, and I'm actually going to shorten my piece of it just a touch so that we have time for lots of good dialogue and questions and answers about what we're seeing at PeaceHealth Southwest in terms of COVID recently, and what we're seeing in terms of variants, which Dr. Melnick spoke eloquently about. So as of yesterday, PeaceHealth Southwest had taken care of 838 patients in our community with COVID. And I'm pleased to say we're at probably a low water mark, at least for the last several months. I think we have 9 patients in the hospital today with COVID, and they're roughly equally distributed between ICU patients and what's called PCU patients, or sort of intermediate patients, and medical surgical patients. And just extremely thrilled about that. The caveat I would say is hospitalizations always lag community rates. So as community rates rise, we do see hospitalization rates, rising typically about 2 to 4 weeks later, and then keep going up. So we've all got our fingers crossed about that. We don't test a lot for variants. We do sometimes when we've got an unusual situation or we're concerned about something in particular. We therefore, it won't surprise you to hear we haven't actually seen a lot of variants yet, but we have started to see some. We have seen the B117, which is the UK variant, and we've seen both of the California variants in our patients that we've taken care of. Just a little bit word about variants, because I think it can get really confusing when folks talk about what the variants are and how many there are and so forth. So at a very high level, there are probably tens of thousands of variants out there, maybe more. Most of them are clinically meaningless. They're just sort of part of the usual viral activity of having change in its genetic structure, and that produces, a variant from original strains. In the US, there are 5 variants of concern. So this is like great terminology. So the CDC describes and categorizes variants into variants of interest. So, they've got some genetic mutations that might be interesting to follow and to watch. Variants of concern, which mean that they may do increased badness to us. So for example, the UK variant, the B117, is probably 50 to 60% more transmissible. So that's a form of badness. Variants of concern also can sometimes be a little bit less responsive to the antibodies, including the antibodies from the vaccine. Though I want to pause there and say, and I really appreciated Ryan speaking about this. The vaccination data itself is confusing and wonderful. The bottom line, if I had to if I'm sitting down across the dinner table with a family member, and we're both vaccinated, so we're talking without masks. The miracle of these vaccines really is that they almost universally stop severe disease, and they differ a little bit in how much of the milder disease you can still get, but they almost universally stop the severe disease, the disease that will land you in the hospital or, God forbid, in the ICU. And that's just amazing. So going back to the variants, there are 5 variants of concern in the U.S., and Dr. Melnick did a good job about talking about the ones that are in our communities. And then there's a higher category called variants of high consequence. I love this terminology. So these are variants that would be really bad, like you would do a test and you couldn't pick them up. They'd have much more significant severity and mortality associated with them. The vaccine might not work on them to a significant degree. And I guess I'm glad to tell you at this moment, we have no variants identified in that category in the United States. So that's awesome. But we really are in an arms race. And I want to underline some of the sobering things that Dr. Melnick mentioned. Every time the virus duplicates and replicates in a person, that's the opportunity for a new variant to form. And that's the opportunity for the variant to escape the ability of our vaccines to work. So we are really in this race between getting the community vaccinated so the virus won't have an opportunity to replicate in them, versus the virus doing what it does, which is trying to replicate, in insane and insidious ways. I also want to talk about one thing that's often asked of me, and that is, Doc, why if I get a vaccine, do I still need to wear a mask? And Dr. Melnick talked about the situations where you don't need to, thankfully. So my wife is not yet vaccinated, but when our whole family is vaccinated, and if she were a stranger to me and I were just meeting her again and going through the dating process, if we were both vaccinated, we'd be able to sit down together. But the initial concern was that folks could be vaccinated and still have the virus reproducing in their body at lower levels, but enough to get someone sick. And that's been proven to be largely, but not completely untrue. So like other vaccines, it does seem to be the case that overall, if you get vaccinated, you're not contagious to others. But there is an exception, and the exception really is that a small percent of people will still be asymptomatic. They'll be protected by the vaccine, but they can still get the virus, again, asymptomatically, and give it to other people. A recent study came out of UCLA and UC San Diego of all their healthcare workers, so tens of thousands of folks who've been vaccinated, and then they followed them up to see what percent of them they could detect the virus at different time points. And the great news was the positivity rate was really low. It was 0.05%. Starting about day 15 after the second vaccine. So really low, but not zero, not a zero. And earlier on, the numbers were a little bit higher. So really reaching that day 15 after the vaccine is sort of a magical number in that respect. Switching gears just a little bit, it is important, therefore, to vaccinate as quickly as we can, as many people as we can, for all the reasons I just mentioned, including being able to continue to open up our businesses. And it's important along the way that we continue to do the usual stuff that frankly, we're all tired of, right? We're feel fatigued by, but the evidence for mask wearing is robust. It's strong. We need to continue to do that. We need to continue to have social distancing where possible. And hopefully the need for all that, once enough of the population is vaccinated, will go down tremendously. But right now it's still super important, both out in public and in your places of business. So the only other thing I want to say is another awesome thing about getting vaccinated, and that is travel becomes much more possible. So the CDC for a long time was very cautious about traveling, and with full vaccination, they feel much more sanguine, much more hopeful that you can travel and not get it yourself and not spread it to others. So that's really wonderful news. So we'll be coming back to some of the things I talked about, I'm sure, but I do want to transition to an esteemed colleague of mine, Dr. Alfred Seekamp, who many of you know is my colleague and CMO of the Vancouver Clinic. And he's going to talk to us about vaccines and vaccine hesitancy.
I'm going to talk a bit about things that we can do as employers and as individuals to really address vaccine hesitancy amongst our employees. And there really are 5 things, I think. One is to provide support and share your experience. So you might say something like, I know that there is uncertainty, but the disease is scary. You also could say, I got the vaccine, I want it for my family, and I want it for you too. I think really delivering those messages with empathy is so important. A second thing you may want to do is talk about the known risks and acknowledge uncertain risk. So the biggest side effects that most people experience are pretty mild. They include a sore arm where you were injected, and sometimes some flu-like symptoms. You can get fever, muscle aches, those kind of things. Usually Tylenol or ibuprofen is adequate to take care of that. But there may be some unknown risks as well. One of the things that the CDC is recommending is that we report these after we're vaccinated. We actually report how we're doing through an app called vSafe. We recommend that all people sign up for this after they've been vaccinated. You know, as Ryan was talking about, the issues with the Johnson & Johnson vaccine around cerebral venous thrombosis really only came to light after 6 million people had been vaccinated. So we want to learn more. We don't know everything, but part of how we get more information is to report things that happen. The third thing is to provide information for people who thrive on facts. So there are very, very complete vaccine information sheets that are available from the manufacturer. And partner with communities. So oftentimes it's even more impactful when someone that sounds or looks like another person provides them with helpful information. And lastly, and I think very importantly, connect with people's desire to protect their friends and loved ones. You know, you're doing this to make an impact in the community so we can get back to normal. We're doing this to protect people that we love. That is a very, very positive motivator. So those are some of the things that I've used with success in getting our employees at the Vancouver Clinic to adopt the vaccine if they're hesitant. So I want to answer a couple of frequently asked questions as well. One, Dr. Neville's already talked briefly about. Why do I need to wear a mask after vaccination? Well, when you're out in public, we have to all realize that not everyone else around us has been vaccinated. And vaccines are never 100% effective. These vaccines are pretty darn good, though. As Dr. Neville has also said, there are new variants out there that are more transmissible. And I think, once again, showing that we care is important. When you wear a mask, you show that you care about the people around you. And mask wearing, I think, will be with us for a good long while until we reach herd immunity, which, as Dr. Melnick said, is around 80% of our communities being vaccinated. Another question I hear frequently, what if I have allergies or I have heart disease or I'm immunocompromised? Contraindication to getting the vaccine right now is an allergy to one of the components in the vaccine. So a common one is around a medication or a component called polyethylene glycol. People with a history of severe allergic reactions after receiving vaccines or other medications, we do a prolonged observation period, 30 minutes instead of 15, after giving you the vaccine. And people who are immunocompromised or who have heart disease are at even greater risk for severe COVID-19 disease and at higher risk for dying. So those people definitely should be vaccinated. Another question I hear commonly is around pregnancy and breastfeeding. The American College of Obstetrics and Gynecology recommends that all pregnant and breastfeeding women should be offered the vaccine. And the vaccine appears to be very safe for both the mother and the unborn baby. And there's even evidence that there are passive antibodies that are delivered to the baby in utero. So that's another helpful benefit. And COVID-19 infection during pregnancy is very, very serious indeed. And we really want to try to avoid that as much as possible. Another question is, do vaccines change my DNA? And the answer to that is emphatically not. Absolutely not. The genetic material in the vaccine never enters the nucleus of the cell where the DNA is stored. So you're in good hands there. If I had COVID previously, do I need to get vaccinated? I actually answered that in the chat, but immunity from the vaccines is stronger and longer lasting. And finally, if I'm young and healthy, do I need to get vaccinated? Once again, the answer is yes. COVID doesn't care how old you are, it can still kill you. So even if you've had a mild case, you still could spread it to others, and you still could get sick and die. So even though you're young and healthy, you still should get vaccinated. So that's all for me. I'm going to turn it back to Dr. Neville.
Thank you, Dr. Seekamp. That was really awesome. Thank you so much. So we're going to transition, I think, into the Q&A portion and of our dialogue together. And I'll be asking some questions of our panelists and invite you to do the same. We're going to do them kind of fast so we can get through as many as we can. And if we don't give you a complete answer, feel free to put that in the chat, and we'll definitely follow up with you. So one of the questions that's come forward has been about children. So the question here is, if you're an unvaccinated, let's say you've got unvaccinated kids, which all of us do right now, and they go to visit fully vaccinated adults from another household, do the kids need to wear masks? And I think, Dr. Melnick, I will throw this question your way, if I may.
So if the children who are unvaccinated visit one household of vaccinated people, so let's say the children who are unvaccinated want to visit grandma and grandpa are fully vaccinated, that's okay. They can visit without masks. If they're going to visit two sets of if there's going to be another household involved besides grandma and grandpa, then the issue is wearing masks. But actually, if the kids are from one household and they visit a household of fully vaccinated people, that's okay. They don't need to wear masks. That's the simplest way to put it.
Love it. Thank you. That's great. Ryan, question for you. How worried should we be? You mentioned the recent news about the cerebral thrombosis, the clots in the brain related to the one vaccine. How worried should we be? Are we going to overreact about this and throw out that vaccine? Should we continue to use it? What do you think?
I really think that unfortunately in this day and age, everything gets sensationalized a little bit. I think if we're old enough to remember, there's been drugs that have made it to market that have had that went through a regular process, Vioxx, various things like that had a lot worse outcomes, a lot broader outcomes than what this vaccine is. I do think we'll continue to use it. It's a really, really good tool. I think it's safe to use. I think maybe what we need to take a look at is what is the best patient population to use this in. I know that again, 7 million people in the United States, many of them in our community have already gotten this vaccine. They've gotten it safely. And obviously I'm not a female that's 18 to 48, but I would certainly take that vaccine. And I know we've had a lot of interest in it from a lot of our employees and patients as well. I think that's honestly probably what we've heard the most as we've done outreach to patients is wanting that Johnson & Johnson vaccine. So, I do think it's going to be interesting to see what the advice or direction that comes out from the FDA. But I do think we'll continue to use it. And again, maybe we look to use it as not the first choice for those women 18 to 48. But I think people should feel safe. There's a lot and I would defer to Dr. Seekamp because he's much more of an expert than me. But when we take a look at things like oral contraceptive use in females and the clotting risks that happen there, those have a 0.3 to 1% chance for every 10 pack years. So there's risk with every medication. Everything that we do has a risk benefit that's associated with it. Just as kind of like a funny side note, when the Harry and Meghan with Oprah interview aired, I guess a lot of British people were shocked at the advertising that happens with the drug industry in the United States and the long list of side effects that you hear with each one, and wondered why anyone would take this. So again, these are side effects that happen with a lot of drugs. This is less than 1 in a million. And if the question comes up, why didn't we see this earlier? Many of these studies, even in normal times, are not geared towards detecting 1 in a million side effects. So I think that's the other thing to remember. We still have a very, very safe process. It's just that the way that drugs are approved, we're not designing them to find these 1 in a million side effects. We're designing them to see their efficacy and make sure that they're safe in a broad term. So that's just kind of my
Yeah.
Dr. Neville, can I add something to that? So
yes, please, Alan.
I think this experience with the Johnson & Johnson vaccine highlights the value and the purpose of our vaccine adverse event reporting system. So there's a lot of misinformation about what VAERS is. And some of the folks in the anti-vaccine community will say, it's cause and effect, it's in VAERS. So virtually every adverse effect, even if you, and I'm going to be a little bit flip here, you fall off a step ladder a couple of days after getting the vaccine, that gets entered into VAERS. But what the purpose of VAERS is, it's a surveillance system. So even after all the millions of doses, of the vaccine, the Johnson & Johnson, the 7 million doses vaccine were delivered, you had 6 people who developed this, it was a pattern, this cerebral, sinus clot. The VAERS system was able to pick that up because it was a pattern in a very few people. And that led to immediate recommendation to hold off on the vaccine for now. I still think the vaccine is an incredibly safe vaccine, but I really want the public to know that there's an additional safeguard in the VAERS system that we continually do surveillance, long after the studies are done for adverse effects, and they're recognized and they're acted upon. That being said, I still believe it's a very safe vaccine, but I want people to have confidence in our surveillance system around vaccine adverse effects.
And just to follow up on that, sorry, real quick, we saw an incident. If you go back when the mRNA vaccines first came out, people were really worried about Guillain-Barré, as there was a couple case reports of that, until they realized when you look at a normal population who have not been vaccinated, the rate of people developing Guillain-Barré after these vaccines was actually less than the general public. So to Dr. Melnick's point, it's something that shows up. People take a look at it, and it's not necessarily, and I'm not saying it is, but it's not necessarily always cause and effect. So you just have to kind of wait for the data to shake out a little bit more.
So I'm going to ask one more question, then we've got to draw to a close. Marvelous panelists. This one is for you, Dr. Seekamp. Even in my own family, I've had people approach me saying, I won't get the vaccine because of infertility in men. Can you comment on that?
Well, I don't think that's been studied to be known, but the thing about infertility in men is that sperm are produced on a very regular cycle. So I don't think men have anything to worry about with that. Women are born with the number of eggs that they have for their whole life, but men produce them very regularly. So one less thing for men to worry about, I believe.
Well, it's hard to beat that as a closing comment. So thank you, Dr. Seekamp. I love that. So back to my Hadley and my Chamber of Commerce friends to close us up.
Thank you. Thank you all. We really appreciate it. And I know there were a lot of takeaways. I know there are going to be people who want to grab some of this information and dissect it a little bit and come up with some more questions. And if you do, we recommend we'll send out some information so that you can further research. I will take some of the links that Ryan had given us, and we'll make sure that everybody receives those so they can do some of their own research and look into some of the articles that he sent. But I also want to encourage, if businesses are out there and they do have questions or need to be connected with the right organization, to use the Chamber of Commerce. We're here for you. We're here to connect you with those resources and want to make sure that we're available to you. A couple of things that I wanted to do to wrap wrap up, I wanted to make a mention again, we do have infrared thermometers that the Chamber and CRDC are giving away for free to our business community, and we encourage you to, if you're on this call, you can definitely put it in the chats right now. Otherwise, you can email, if you're watching this afterward, yourchamber@vancouverusa.com, and we'll make sure to reach out to you and get you the non-contact infrared thermometer to help keep safe. Another thing that I do want to mention is we will be putting together some more webinars. If you have questions, things that you think that should be covered and are related to the business industry, please let us know, and we'll gladly look into it and put something together. But one of the things that we do want to put together is a panel of some of our HR experts and those that are in the industry that can walk you through as businesses on how to reopen, how to answer those questions from your employees and your staff, and what you do when those employees do start to come back into your workplace. Because I think there are some legal implications. We want to make sure people understand the policies and the laws in the state of Washington so that your business can not only be in compliance, but that you can offer the services and resources to your staff that are going to be available to you through organizations like the Chamber and through the state of Washington. With that, I want to thank everybody for attending. We will be putting out, again, a video. It'll be up on our YouTube channel. There are a couple other YouTube videos that I think are going to be relevant for everybody, especially staying safe in a COVID pandemic environment. And we look forward to hosting another Mind What Matters here pretty soon. So thank you all for joining us from the Chamber of Commerce. And please reach out if you have any questions. We're here to help.